Hi, I'm Katie. I'm a midwife and lactation consultant, and in this breastfeeding series, I'll be answering the most frequently asked questions around breastfeeding in the first hours, days, and weeks. It's normal for your breast to feel full on average around the second to third days after birth. When we describe the milk as coming in, what we actually mean is that the volume of milk increases. Once your milk comes in, you will definitely know it. For most mums, there is no missing the increase in size of their breasts. As your milk comes in, obviously there is a lot of activity happening, so you may feel a little warmer around the breast area, and this can even feel uncomfortable for 24 hours or so. As your baby starts to drink more, your breasts will regulate themselves and the sense of overfullness will settle. So what is the difference between normal breast fullness and engorgement? With normal fullness, the breast and areola, the darker skin around your nipple, remains soft. Your milk flow is normal and your baby can still latch on easily. Engorgement is slightly different. Engorgement typically begins on the 3rd to 5th day after birth and subsides within about 12 to 48 hours if properly treated. It might occur in one or both breasts. Your breast and areola will likely feel hard with tightly stretched skin which may appear shiny, and you may experience warmth and tenderness. Engorgement may extend up into your armpit as well, as the breast tissue inside is shaped like this teardrop shape. Your nipple may also increase in size and become flatter or pulled in towards your breast slightly, making latching on more challenging for your baby. You may also have a low-grade fever. So, what are the best tips to prevent engorgement? Breastfeed early and often. Don't skip or delay feeds, even at night. Breastfeed every time your baby cues for a feed. If your baby is very sleepy, wake them every 2 to 3 hours, allowing one longer stretch of 4 to 5 hours at night. Allow your baby to finish feeding at the first breast before offering the other side. Seek help to ensure you are latching your baby on at the breast correctly and comfortably. If your baby is not able to breastfeed well or frequently enough, you will need to pump your breasts to make up for the missing feeds. A baby should be feeding a minimum of 8 times in 24 hours. For example, if your baby is sleepy and only breastfeeding 4 or 5 times a day, it's important to pump the extra 4 times to keep your milk supply flowing and to minimize the engorgement. So how do you cure engorgement? Before breastfeeding, gently massage your breast from the chest wall towards the nipple. You may find cool compresses are both soothing and helpful, and use these for up to 20 minutes before feeding. A warm, wet cloth held on your breast or a warm shower with the shower hitting your back rather than directly on your breasts for a few minutes before breastfeeding may help your milk to begin to flow. But don't use this if you have edema, also known as swelling in your breast, as the heat could make it worse. If your baby is having difficulty latching on to a feed, try expressing some milk out first to soften the nipple and the areola. Something called reverse pressure softening can also be helpful for you to look up on how to use. And continue to gently massage your breast during breastfeeding as well to help the milk flow between feeds. If your breast is uncomfortably full at the end of the feed, then express your milk until your breast feels a little more comfortable, but only express to comfort. Some mums find that using a cold compress over a layer of clothing for about 20 minutes can also be very soothing. Also make sure that your bra is comfortable and well-fitting. Tight or poorly fitting bras can dig into your breast and potentially lead to blocked ducts and mastitis. Contact your lactation specialist or healthcare provider if the engorgement is not relieved within 24 to 48 hours, or if you feel that it's getting worse. And also, if your baby is not able to breastfeed, not waking regularly for feeds, i.e. they're feeding less than 8 times in 24 hours, or they're showing signs that they are not getting enough milk, please seek further support and advice. Watch our video on how to know my baby is getting enough milk for more information.